The busiest that I think we've ever had with 211. In light of the pandemic, we saw exponential increases both in the number of contacts that were coming in as well as the length and complexity. When you look at the data and we look at it for a number of past years and then look at it during the pandemic, is we saw the biggest shifts and ebbs and flows. So normally you'd have the same kind of top 10 issues that stayed in the same kind of order of how you would receive them. So usually pre-pandemic, financial need was always the top call issue that we always had. And again, it's remained in our top 10. But it hasn't always been the top issue throughout the pandemic. So we saw a lot of shifts, even month to month, in terms of what we were seeing on the lines. And some of that came with what was going on externally in the community. So with public health announcements, public health restrictions, different government programs that became available to support people during the pandemic, like the Masks for Albertans, COVID isolation supports, transportation to vaccination appointments. And so we saw a lot of shifts and ebbs and flows over the 2 years. Now, it was hard. Especially I think at the start of the pandemic, when there was so much uncertainty and people just didn't have answers, that you were dealing with anxiety from who you were supporting that was reaching out, but then you were dealing with that uncertainty and anxiety in your own life outside of your work. I think with the pandemic, nobody made it through the pandemic without being touched by COVID in one way or another. So to have that be your everyday at work, but then you're also dealing with it in your personal life when you go home, there's just really no escaping from it, and that no real reprieve from it. More people have needed to access supports and services than ever before. And there's still a lot of stigma around reaching out and asking for help and support and waiting till a situation escalates to that really dire situation. There is that immediate mental health crisis going on, but where, I just maybe need additional support with my family, don't really know where to go. It's not a crisis situation, but I think there's just probably something out there that can really help us to strengthen and get further connected into our community. To people who are like, I want to give back to the community, I really want to donate, but I don't know where to go. Just a wide breadth of what people can reach out to 211 for. I think if I go back to when I was in school, I remember sitting in a gymnasium, I want to say like I was 7, and they come in and they do a big presentation that if anything's ever going on and you don't know who to call 911. So it's embedded into us from early childhood. People, coming into Canada, it's one of the first things that they're told. So often people are calling 911 as the default when they don't know who to call. And so really that was that Make the Right Call campaign, is just about educating on the other numbers and services that are available for people in our community. But we know that outward education isn't the only piece of that. And so we've been working really closely with our partners at CPS and 911 of how do we better coordinate on the back end so that if a call comes into 911 that, really just maybe needs some counseling resources or maybe needs to get connected into some financial supports, or some parenting classes. How do we make sure that those people are connected into community agencies and services that are available versus that emergent police response? And so for the next 5 months, we're actually co-locating some of our 211 resource specialists alongside 911 so that we can really look at diverting those calls that can be diverted into a community response, as well as doing some co-evaluation and co-response on calls that maybe still need a bit of that emergent 911 and police response into it, but also need that connection into community for those wraparound supports. We actually just got a message from one of our staff today who took a call from 911 that was transferred over and just said, this is why I do this work, and this was absolutely amazing, and I love this. It's an opportunity to blend both my crisis skills and my resource navigation skills to be able to just better support community together.